Signs your baby is getting enough breast milk. Instead of trying to gauge the quantity of your breast milk production, it's more important to keep an eye on the signs that your baby is getting enough breast milk. If you're ever in doubt, talk to your healthcare provider or lactation consultant, who can help guide you in this process. These are some of the signs your baby is probably getting enough breast milk and that your supply is well established. Your baby is gaining weight. One of the most reliable signs of successful feeding is your baby's steady weight gain. Keep in mind that your baby will likely lose a little weight within a few days of birth, usually no more than about 10% of their birth weight, but they should regain it within a couple of weeks. Take a look at how baby growth charts help your baby's healthcare provider track their growth. Your baby is going through diapers. The number of diapers your baby goes through is a good indicator of whether they're getting enough milk. A few days after birth, expect to change around 6 wet diapers per day, and check that your baby has 3 to 4 bowel movements a day. The stool will be dark and sticky, called meconium, in those first days after your baby is born, but will become loose and yellowish afterward. The color of the urine should be pale yellow, not dark yellow or orange in color. Your baby is breastfeeding often. Healthy newborns tend to feed at least 8 to 12 times a day, approximately every 2 to 3 hours. Your baby is breastfeeding more during a growth spurt. During growth spurts, which may occur around 2 to 3 weeks, 6 weeks, and 3 months for some infants, your baby may nurse for a longer period of time and more often during the day. Follow your baby's lead and let them nurse for as long and as often as they like. Your baby seems full after feeds. When your baby is full after a feeding, they will have relaxed arms with outstretched palms. When they want to eat, their arms will be flexed with hands in a fist, and they may even try sucking their fingers. Your baby seems happy between feeds. If your baby seems satisfied, happy, alert, and active, not cranky or fussy, after feedings, chances are they're getting the nourishment they need. Your breasts feel soft after feedings. Your breasts may feel firmer and fuller before feedings, but afterward, they may feel softer. But when your little one is between 6 weeks and 2 months old, your breasts may feel less firm in general, which is normal. In summary, your baby will provide many signs to indicate that they're getting enough breast milk, including gaining weight, going through many diapers, breastfeeding often or more during a growth spurt, and seeming full and happy after a breastfeeding session.